Breast cancer is the most common cancer among women. In 2024, it's expected that more than 360,000 women will be diagnosed with breast cancer. However, there is hope because early detection of breast cancer can make a huge difference. When breast cancer is diagnosed at early stage, the survival rate can be as high as 99%. Hi, I'm Dr. Tan Gi Hui, a consultant breast and oncoplastic surgeon. Today, I'm going to be sharing with you some important knowledge about breast cancer. We will be talking about signs and symptoms, risk factor, and how early detection can save life. So, if you're concerned for yourself or loved ones, knowledge is the key. Breast cancer happens when the cells in the breast tissue grow out of control. Slowly, it will form a lump or a mass, and almost often, it occurs in the breast duct or the breast lobule, or what we call the gland. If the cancer is not detected early, it can spread to other parts of the body, and this will make treatment harder. There are certain risk factors that has been associated with breast cancer. So generally, we divide them into non-modifiable and modifiable. For the non-modifiable one, this includes age and family history. The older we get, the higher the chance of getting breast cancer. And as per family history, if we have a close family members who have breast cancer, for example, our parents, siblings, or children, then we face a higher risk for breast cancer as well. For the modifiable risk factor, these are usually associated with lifestyle choices, excessive body weight, lack of exercise, or what we call physical inactivity. Excessive consumption of alcohol does increase your risk as well. So, by making healthy lifestyle choices, we can actually reduce our risk factor for breast cancer. It is important for us to know the signs and symptoms of breast cancer so that we know when to seek help. In very early stage of breast cancer, there is usually no symptoms. So that's why screening is important. The common signs of breast cancer include a lump, and most of the time it's actually painless. Sometimes there is changes in the breast size and also shape. Nipple discharge or nipple retraction are also symptoms of breast cancer. Sometimes patients may see dimpling on the skin or redness and ulceration. These are signs that you need to go and see a doctor. Breast cancer progresses from stage 1 to stage 4. When in stage 1, the cancer is only confined to the breast and is usually less than 2 cm. But when the disease reaches stage 4, it means that it has spread to other parts of the body. For example, the lung, the liver, the bone, and the brain. The treatment of breast cancer include surgery, chemotherapy, radiotherapy, hormonal therapy, and targeted therapy. Early detection is the key to the success of treatment, and the earlier the stage of breast cancer, the better the prognosis. Early detection through regular breast self-examination and mammogram can save life. One of the best ways for early detection is breast awareness, knowing how the breast look and feel under normal circumstances, so we are familiar with our breast. So if one day there is changes on the breast, for example the look or the feel, then you know to go and see a doctor as soon as possible. Regular mammogram screening is advised for women who are 50 years old and above. For those with high risk factor, they can start as early as 30 years old. The earlier the breast cancer is detected, the better the treatment outcome. If the breast cancer is diagnosed at very early stage, the survival rate can be as high as 99%. Together, we can create a community of empowered women who prioritize their health and well-being. By sharing knowledge and also encouraging each other, we can take proactive steps for ourselves and our loved ones. Breast cancer awareness isn't just about knowing the risk, it is about empowering each other to take action. Join Guardian Malaysia in raising awareness this pink October. Take charge of your health.